And my doctor that will be doing justice to Afro course is Dr. Neku Ukolugbo. He here knows third surgeon with Valley State University Teaching Hospital, Bugara. Good morning. Thank you for joining us on the show.
Good morning. It's always my pleasure to be here.
Okay, straight on. Let's go to focus on the record of 62,000 confirmed cases in Nigeria, and the start cases 51,000, so fractions. Where can we say we are right now when it comes to the issue of COVID-19 in our country, Nigeria?
Yeah, where we can say we are now is that we are in a good place. We are in a good place as a nation, and I will almost say, well, there was some good response as a nation, in the nation as a whole, and particularly in Delta State. But a lot of it also could be like somebody explained it and said that it's as if the Chinese brought the fake COVID here. The way they normally bring fake things and took the original one down. Because we can see what is happening in the United States, for example. They're having second surges, they're having second spikes everywhere. Yes, where we are now, we've practically flattened the curve here, because that period where we had so many cases all over the place, it's gone. And now we are having a situation where we have very few patients presently on admission in the government centers. I think probably less than 10 or less than 5 in the government centers. And we are seeing a situation where, but because of that, people have let their guard down. You can see that I went to an occasion over the weekend, and I was the only person wearing a face mask in the entire. I was looking strange. I was the only person wearing a face mask in the entire occasion. And you go to churches now, and suddenly everybody stops wearing face masks. Everybody is hugging. Everybody has gone back. Yes, everybody has gone back to handshakes. No more hand washing. It's important for us to know that what is happening over there in the United States can actually happen again. We can have a second surge. Okay. Let us not depend on what they're saying, that we have the Chinese send the fake one to us, and that the real one is happening in the United States. No. We had it here. People died from it. We saw it physically. We saw it. It was real here. So I believe that where we should be is that we shouldn't let our guard down so quickly. We shouldn't stop all the measures we had put in place.
Okay, talking about letting our guards down, I'll record our report of the peaceful protest that was done recently some weeks back, where a large number of persons
exactly
putting on the
face masks. Exactly.
What would be the expectations?
Yes, that was those kind of events are called the so-called super spreader events, because people meal together in crowds, and all you need is for one positive person to infect a large number, because it's just going to keep on giving out doses of the virus at intervals, and people will just be taking them in. So those are super spreader events. Yes, the NCDC and the Presidential Task Force has actually come out to say that they expect some of the numbers to come up because of the NSAS protest. Yeah, because they would have had opportunity for people to mingle the same way, you know, since the lockdown was eased before this NSAS protest came up. You find that a lot of occasions have come up. People are doing burial ceremonies, weddings. You see people gather together and they are spraying money and all that. All those are all good opportunities to be transformed to super spreader events. So, like I said, let's not take the grace of God in vain. Let me use that word. Let's not say because we are where we are now, we just prepare ourselves to go back to the normal, and we just have a second surge come up.
Okay. Okay, from the report of the presidential task force, Chairman Boss Mustafa, you did say that isolation centers should not be closed. Are we expecting more confirmed cases in NS rising from the protest? Or why the statement? And what should Nigeria at this point in time do now that the curve has been flattened?
Well, the issue about isolation centers not being closed is for you to always be prepared, just in case. Yes, for the unexpected, and for the personnel, the medical personnel, to be on the alert. Yeah, because like I said, by the time you start having a surge coming up again, a second surge, it's going to be obvious. People are going to start coming down with the disease and all that. But to be fair, because of this theory about head immunization, which you all know about, that a lot of people have developed immunity, and the weaker ones have died, the stronger ones have survived and have conferred immunity on the others. We are actually hopeful that we are not going to have this second surge coming up. But while we're being hopeful, that doesn't mean that we will now let our guard down. We have to be prepared for anything.
Okay. In the management of COVID-19 pandemic, are there areas, gray areas that should be considered or looking towards the effective eradication and elimination of the virus?
Yeah, the area to be looked into really is developing a vaccine. And you can imagine, you can see that there's a race in the world now. Russia claimed to have come up with a vaccine, which is still being contentious. The United States, I mean, it has become politics because the present president of the United States is trying to make sure it comes out before the election so that it serves as a winning tool for him. Because the whole idea is that everybody is hoping that once a vaccine comes up, then it's going to be a major breakthrough. Why do I say that? Because there's really no cure. COVID, as it is, doesn't have a cure. There are several studies on it. I have personally been involved in some studies in COVID. People say chloroquine works, people say it doesn't work, people talk about vitamin D, people talk about alluvia, antiviral. All these are all in trial phases. Of course, then there's remdesivir. Remdesivir is the only proven drug which is out of the reach anyway, and it is for the critically ill ones. Then they've talked about dexamethasone. People have used dexamethasone for critically ill patients. But all this is still trial.